Welcome to Skills Not Pills movement, everybody, an oasis of hope and inspiration where you can learn self-mastery skills and become your own health CEO. It is a community of like-minded people who know healing and total transformation are possible because we have claimed our own cures. Visit our website at www.skillsnotpillsmovement.com to find out about monthly membership and how you can learn from experts like today's guest, Jamie Guyden. And I'm Carrie Hemmingberg, your host. I'm really excited. Today we're going to talk about bioenergetics medicine and shifting the way we think about who we are. Jamie is a medical doctor with over 14 years of experience in medicine. Her personal health journey with systemic lupus led her from a conventional medical career to creating a holistic practice, Evolve Integrative Care. She finds tremendous passion helping her clients realize their true healing potential while living life without disease. And so you can visit her website. The link is in the description of this broadcast. And welcome, Jamie. I'm so glad you're here.
Carrie, thank you for having me. Again, thank you for creating this platform. Skills Not Pills is amazing. Anytime we say the word, people are like, oh, what's that? So yeah, happy to be here.
Yay, it's awesome. And I know you, of course, so I know a little bit about your journey, but for the audience sake, give us a background on, you've been a doctor for over 14 years, you're practicing conventional medicine, and you made a change.
Yeah, so I actually started my healing journey when I was 16 years old. That's when I was officially given the label of systemic lupus. And at that time, this was over 25 years ago, nobody really knew what that was. Like, we're really familiar with autoimmune diseases these days, right? It's kind of like a buzzword. But at that time, everyone was kind of confused. Like, I think my mom mentioned that there might have been an aunt who died from lupus, but nobody really understood it. So we were all kind of in the dark around this illness. And likewise, I was 16 years old. Like, I wasn't thinking about, I didn't want to think about that. As far as I was concerned, I wanted to think about the prom. I wanted to think about fitting in. I wanted to think about my hair growing back, because the reason why we ended up going to the doctors because my hair was falling out.
Oh, wow.
So anyway, I ended up being a really good patient for 15 years, which meant I took all of my medications, and that could, at any one time, could have been 10 to 11 or 12 medications. Tons of side effects, tons of hospitalizations, tons of never really feeling well, just doing what I was told because I didn't actually know any better. Lots of people ask me, is that why I ended up going to medical school? And it wasn't. I started out as a journalism major and was in the first class, and I was like, oh my God, no, this is not for me. And then joined a sports medicine club, and then ended up falling in love with the idea of medicine at that time. But there was this intersection years later between being a physician. I had already graduated, I finished my residency, and I was in a medical practice and just getting sicker and sicker. And it just dawned on me, like most of us who have these awakenings, that this can't be it. There's got to be more to my life than taking these drugs, being completely overweight, being really unhappy, and being mean. I was just a mean, angry individual, and I did not like that any longer. And this is who I became. This is what people knew me as. This is that's just Jamie kind of talk. So anyway, fast forward to today. Essentially during that time when that epiphany hit me, which was about 8 or 9 years ago, I just decided to change my life, and I didn't know what that meant because, again, I was a allopathically trained medical doctor, and all I knew was we diagnose it, we treat it with medications or surgical intervention or put people in therapy, and that was the end of it. So I went on this search to find, what might be out there aside from what I was already doing. Found a holistic practitioner, started working with her. Within 2 years, off all medications, which was told would never happen. Completely felt like a new person, and that really started my journey to mind, body, spirit medicine. Evolve's doors didn't open until 3 or 4 years after that, maybe 5 years after that, when I really kind of captured the essence of who I was, finally. And that was a person, you said in the beginning, who we have claimed our cure. Yeah, like I claimed it, and I was like, I'm done with this. I'm not embodying lupus. I'm putting that over there on a shelf. And I even hesitate now to even tell people I was diagnosed with lupus, because that's not a part of my journey anymore. That's not who I am. I have no relationship with that. I have no signs or symptoms of lupus. I don't take medications. I don't need to be hospitalized. There's nothing there for that. So that's a short version of the journey.
You know, I love that you said, I don't have a relationship with that anymore, because really it is a relationship. It's like when you shift past your thing, whatever that is, like, it's just, you don't have a relationship with that anymore. It's just done. That part of your journey is over. I like to think of them like these diseases or illnesses or conditions, whatever you want to call it, as like teachers. You know,
Absolutely.
it came in to teach us something or to bring us on a new leg of our journey. And it brought you on a new leg of your journey, which has served its purpose.
Teacher is absolutely correct. And then the next word is choice. Like, we're in choice the minute we get that diagnosis, the minute we are told of this very disempowering thing, to either embody that and be that thing, or say, you know what, go on with that. I'm going to find a different avenue to, exist in. And that's what people are doing today. They're doing that a lot more today than they used to do, right? Like, people will be like, well, I was diagnosed with stage 4 this, and I'm not taking any of that stuff. I know there's another way, right? So yes, they are here to teach us. Are you listening? Are you willing to learn? Are you willing to grow? I always tell people, I wouldn't give this back for the world. I love my journey. It was perfect. It was beautiful. It got me where I am today. And now I get to spread this message of truth and empowerment, which is very different from our current medical model, where we're just really shutting people down at the door. And I'm just glad to be on the other side of that.
You know, I am so glad too, because I know, I've talked to several doctors, and I know that experience of being in that rigid healthcare system that we have right now, I mean, I know it's really doesn't serve in the way that they thought they were going to be serving when they signed up to be a medical doctor. I mean, is that accurate for your assessment?
Yes, but it happened eventually. Like, in the beginning, in med school, you're just all happy. You're like, oh yeah, you're going to be a doctor. But over time, as I began to grow, it didn't fill my heart, right? I literally, at the point where I was off of all those medications, I was like, wow, now you're just a drug dealer. Like, is that who you really want to be in this lifetime? And so everything that I was taught no longer resonated. It just no longer made sense to me. And I just knew, even though I didn't know what that was, that there had to be another way to be looking at this. And gratefully, we're in such a space in time where people are ready for this information. Even doctors, right? We tend to be really egoic, and we tend to be really hard-headed, and we want to see the evidence inside the 3-dimensional box. And I love you, because I'm a doctor too. But people are waking up. They're waking up to the idea that, maybe what we've been taught isn't exactly accurate, or there are other pieces to the puzzle that we need to know.
Now, I know that we're going to take a journey, and I don't want to take a huge diversion, but I want to say that one of the big realizations I had, because I'm putting together, I'm going to be going out and doing a media launch about Skills Not Pills to reach more people. And I had to really think, like, okay, what is it, Carrie? And really, it's like the whole system needs to be revamped. The whole way that we think about illness and disease, and categorize it and label people and give them this diagnosis, and then the way that we treat it, and the way that we treat our doctors. And we have like 15 minutes, and the patients take no responsibility for their own health. Like, the whole system needs to be revamped. And that's really what this movement is about.
I'm nodding my head off. Like, my head is... Yes, it's like, it's no longer, Nassim Harriman, I love his quote when he says, it's not about thinking outside of the box. There is no box in the first place.
Take that box out.
We have to, it's redo, okay? The old paradigm is about being broken. It's about needing to be fixed. It does not respect your perfection, your energetic perfection at the start. So we can't keep trying to fit in, it's not going to work. You have to bust out. You have to bust out, put your wings on, and be ready to fly to a whole nother paradigm. And honestly, if I'm being perfectly honest, it took me a while to get there. It took me a while to be able to speak up and speak out, because again, I have been so indoctrinated with a very specific version of how this goes, right? But, you know, I think it's going to take folks like me and other skills, not pills, advocates and experts to just start telling the truth. Just start saying what we truly know and we truly understand about how healing works.
Yeah. And we can't worry about being crazy, you know, because there's that aspect when you start speaking something that's outside of what people's norm is, or when it's outside of their, what I call domestication, outside of their system of thought, like people just go, what, you know, but at some level, if enough people, there's so many of us, I've talked to so many people like you who've had the same experience. Like we went outside the system and we found the healing. And now we look back in the system and go, wow, I see how I got sicker because of the system. I didn't get better. And I only got better by getting out of that system and into this new place and totally shifting my perspective and my thinking process into a wellness paradigm. So yeah, I love that. Awesome.
Yes.
I had to take that diversion with you because I knew you'd want to take that. So, okay. So now people are wondering, well, all right, what is this new paradigm? What is it, Jamie? Like,
yeah. So you have to, the first thing you have to do is identify the basic premises of where we sit right now and say, well, maybe this is a problem, right? And there's probably 2 or 3 of them. The big one is that healing is external to you, that there is something, I mean, this movement's called skills, not pills. The idea that pills, and in that category, I put supplements, I put herbs, you know, those are beautiful things, but this notion that when you pick up the bottle, I'm healed, right? That's flaw number 1. That's problem number 1. It's not external to you. I'm sorry to tell you, baby, you are this beautiful, powerful, divine, innate light that shines and has all of the self-healing machinery within you and around you to tap into at any moment, right? And so that's number 1. And that goes along with what I was saying about being broken. You're not broken. There's nothing to fix here. There's nothing that you're going to be able to grab that's going to stitch you up or fix you right, right? The premise number 2 is around how we view ourselves physically, right? We believe that we're these matter-based biochemical beings, right? So we think we're cells, tissues, organs, skin. We can touch ourselves. We can measure things in our body. We can look in a microscope. And that's true on one level. But the big piece that's missing is that you're energy first. You are energy first. Your biochemistry is absolutely taking direction from your energy body, which is your physics, which is your quantum physics. And we keep having these conversations more and more these days, that quantum physics is not this hokey doke kind of science. It is replacing Newtonian matter-based, mass-based science, right? So we have to have respect for that as well. And then if I had to pick a third premise, I'd probably say separation of our emotions and our emotional body from our physical body that's nonsense. You are not, your emotions are 100% linked and tied to the way that your physical body is choosing to manifest disease. And that's just who you are, right? That is who you are. You are a biological, energetic being, right? Hence bioenergetics. So now we have to take a look at a paradigm that respects that. So I'm perfect energy already. My body already has all of the tools and guidelines to do what it needs to do. And I'm connected on a much deeper level than I'm aware of. What do we do with that? What do we do? What are we going to do with that? That's a whole nother way to assess you, right? You take away the idea of diagnosis. You take away the idea, and that's where I talk about disempowerment. It's so disempowering to be like, you got this. Take that.
Can I speak to that for a second? I mean, it is. Yeah. I've been looking back and you know, did I have some challenges I need to go through? Yes. Do all of us? Absolutely. Was I acting out as a 15-year-old? Yes. Being full of my emotions. What 15-year-old isn't? Okay. And at the time when I was acting out and I got into this psychiatrist's office, he basically labeled me with a diagnosis. That's the first thing he did. And he's like, well, I would give you this other one that's worse, but I won't put that on your record. So now they've got the whole paradigm of like in trouble, right? Like there's something wrong with me. I need to fix it quick because I got to. And you look back and you see how that creates this whole system of thought, and it just feeds and feeds itself. And if there's one thing I've learned on my journey, it's my power to create stories about what I'm experiencing and then create more of the same.
That's right.
And that's one of the things we're teaching people in this program, right? Is like, be mindful of what you're speaking about yourself and how you're dealing with it, and learn some new skills, right? Learn some new skills for navigating that space, because the energy does follow what we're saying.
Absolutely. So that's, people panic about the word energy, and I'm still not sure what that is, because if you think about energy can be measured mathematically, it's frequency, right? So frequency is hertz. It's a measurement that people take to understand who you are, right? So yes, energy is this thing that's always moving and changing and taking feedback from you, right? There's this interdependent system between your physical body and your energetic body, and they're always dancing, right? So, right, you get out of a doctor's office and they say, you got this, you got that, you're branded. Do you feel good when you leave there?
No.
Do you feel any hope? Do you feel any power? No. So now we have to create a paradigm in which whatever you're saying when they are leaving, there's a sense of power to start working with that field, right? You can start working with that field. And here's the next level of that. That field, your energetic field is connected to everybody else's energetic field, right? So doesn't it stand to, let's just say for a minute you believe everything I'm saying. Doesn't it stand to reason that it's in all of our best interest to start to move towards a healthier society? Because where I sit, your pain is my pain. Your disease is my disease. Your depression is my depression. There's been all this talk about the mass, all these suicides happening. It doesn't surprise me. Our collective consciousness is connected so intrinsically, right? So the despair that one fellow is feeling is the same despair that the next one is feeling, right? So it really is in all of our interests to start to move to this new paradigm where it's about power, and it's about innate knowing, and it's about self-healing, and it's about respecting energy and stop being afraid of it. It's not woo-woo. This is the new science, and we need to really just get on board with that.
Yeah. I did not heal until I started working with the energy. So my healing began, number one, when I decided to be my own health CEO.
Nice.
Okay. And that's what we're calling it now, Jamie, because I love it. Don't you love that? Yeah. It's not shaming. It's not it's basically saying, no, just be your own health CEO. You're the one. You're in power. You're the only one who can do it, because the doctors can tell you all day long what to do. And if you go home and you don't do it, well, nobody can help you. You have to help yourself. And
that's right.
Can you just ignore what you're eating? No, that's not what we're saying.
Right.
There's multiple levels of your being. You've got to pay attention to all the levels, but you've got to claim being a health CEO. And then you've got to work with the energy, because sometimes things don't have words. Like, things get planted in your field that in your energy, like this diagnosis, for example, that becomes like a cloak that you wear around, and everybody perceives it.
That's right. That's right.
At some level, they all perceive it. They all know there's something about you that I don't know what it is. And clairvoyant people will have more access to that, but everybody at some level feels it.
But that's why everybody interacts with energy and they feel it. They might not have a term for it, right? You walk into, or you're at a party and someone walks in the room and all of a sudden everybody's in a bad mood, or you go into a specific place and all of a sudden you feel like crap. These are examples of you feeling and interacting with energy daily. Like, some of us call it vibes, I like his vibes or the vibrate, whatever you want to call it, we're all interacting with that. And at the end of the day, again, let's say you believe what I'm saying. If that is what is telling my biochemical body how to be perfect and how these hormones do all these miraculous things and at the speed of light, and how these 100 trillion cells are able to respond instantaneously, if that's what's telling my body what to do, I'm going to go to the energy. I'm sorry. Like, to me, it's a no-brainer. I'm not going to have my ego be in the way of, me actually knowing myself in fullness, right? And that's really what this boils down to, is us having to put our stake in the ground, because you have to, at that moment, you have to say, well, everything I thought I knew wasn't entirely correct. You have to be okay with that.
And that is hard for people. I have had conversations with psychotherapists and people who have been in the business a long time, and they've been trained. And there's this system of being right and wrong that's so entrenched in our society.
Yeah.
And there's huge judgment when you get into certain professions, for example, like a medical doctor or a psychotherapist or a psychiatrist. The defensiveness that people can have towards new ideas in these fields is extreme. And I'm just going to posit that when you said no brainer, that's exactly right. You want to step into, if you really want to expand and you want to come on this journey, which is the future anyway, so you can deny it all you want, but this is actually where we're going.
Right.
You're just going to fade out, basically.
Well,
and
the truth,
it's going to come in, right? This new thought. So you've got to be able to loosen up your ego a little bit. You've got to be uncomfortable and go, you know what? I was trained a bunch of things that might not be true.
That's right.
Gulp, gulp.
That's right.
At some level, I knew it.
The truth just is, right? It just is. There's no end of this sentence. So our belief systems around what is true and what is not true are just our belief systems. They don't necessarily embody truth, right? We make up a bunch of facts, and then they become a part of our collective consciousness, and then that's who we are. But that gets to move. That gets to move, and that gets to be different at any point in time. So yeah, look, this is fun, and anybody who wants to learn this stuff, come on, let's learn it together. Again, I'm being selfish because it really is in my best interest and everyone's best interest for us all to really start to learn this about ourselves, right? And then we just change the landscape. This doesn't mean you're not going to have a job. This doesn't, these are the other things that people get. If everyone's healing themselves, what am I going to? So let's just not go there for a second. Let's just spend a moment in the pure glory of the idea that you embody all of that you have that power, and sit with that for a minute.
I want to speak to that for a second, because I felt that coming on, like people are saying, oh no, if people are getting well all by themselves and you teach them all the skills, then who's going to have work? Let's just address that for a second.
Yeah.
So there's all different levels of ability to self-educate. There's always going to be people that need assistance, need a little helping hand to learn new skills. And so why don't we focus on teaching skills and teaching self-empowerment and self-healing, rather than having this old system that limits potential? Why don't we start teaching skills, and why don't we open up our own minds about where it could go? Because when you really come into this space, you start to realize that so much of what we're experiencing is completely driven by our collective conscious belief. Yeah. So we have a collective consciousness belief right now that, that these things work, right? That these things really help. We have a collective, do they really? Well, our science is saying that it does, but maybe not. I don't know. We don't know. I think it tastes great. I'm drinking it. It helps me right now, because in the current model, it's working, right? In the current model, we believe that this is working.
Yeah.
But in another 5 years, it could be something else that we all agree and believe. And in fact, if you look back and you do research, you can prove that this is true, because you can go back and see the introduction of the SSRIs into the market, the medication for antidepressant and anti-anxiety. That did not work at first. It did not work at all until they put advertisements on television.
Of happy people dancing around and swinging on swings. And
as that permeated people's consciousness, those pills started working.
Yeah.
And they don't even work effectively. Like they're having a hard time assessing the effectiveness now because of all of the advertising. So just realize that this is really a new paradigm of belief, right, Jamie? This is where we're going.
Absolutely. That's what, that's like the next level of knowing who you are, that being able to manifest instantaneous health and being able to, do all the things that you want to do and be all the ways you want to be, right? Just as long as we keep knocking down the armor that we have up. So I put up a post yesterday about age. Like, age is not a freaking diagnosis code. Like, that's not real. Right? Like this idea that, oh, I'm old and so therefore I must have this problem. Let's let that go. That's nonsense. And so it's just an idea of, it's an example of these suits of armor that we wear, right? And so this is, Skills Not Pills movement is about, let's just strip one away at a time, one layer at a time of all of this armor that we have and all of this unconsciousness that we hold, and start to get to our true nature.
Sorry about that.
Okay.
Yeah. Well, that's awesome. I totally agree with this. So, we have got a few minutes left. And so I just like you to, what does this look like? Because this is such a new paradigm. People are like, well, what do you even do with me? What even happens? Like,
yeah. So
do you take my temperature? Do you look at my tongue? What do you do with me?
Right. So here's the first thing. There are going to be thousands upon thousands of ways in which you can now start interacting with and becoming aware of your energetic body. The modality I choose to use is a biotechnology, which means it's a software that goes on my computer and it allows me to scan the energetic field of my clients. And we just work at that level. Now, on the same note, I am talking about nutrition because food is necessary for your motherboard, right? I am talking about nutritional supplements. If your vitamin D is 5, I'm probably going to put you on vitamin D, right? So I'm working with the biochemistry, but we are always asking the energy, the perfect energy, to lead us and guide us where we need to go. That's the nice thing about this biotechnology, is we take the guesswork out. When I first opened my practice, I started with blood work and hair analysis, and there was still some level of guessing that needed to happen on my part, some level of intuition, some level of just education that needed to happen. When you start interacting with energetic fields and they're telling you exactly where to go, this is where the information is being distorted, this is the frequency that needs to be imparted, or the information, because that's what energy is. Energy is just information that your physical body needs, and it just takes the guesswork out of it. We do that thing, and then all of a sudden you start to heal at this very rapid rate. This is quantum healing. This is like next level healing, where you're deathly ill, and then 6 months later you're like, what did you do to me? So, but I say that in jest because I do want people to feel comfortable with whatever energy modality they're working with. As long as you're with a practitioner that you feel safe with, right? And you feel empowered around, whatever you do is going to work.
Yeah, and it's
going to work. Yeah.
That's really the whole point of this movement, is because we need to train ourselves how to listen to our own intuition. And so, for example, if you've been listening to this broadcast and you're listening to Jamie, you're going, wow, I'm lighting up inside. Like, I'm excited about this potential. Something in me is going, yes. I'm leaning in. I feel more open. I feel like, wow, I want to find out more. Pay attention to that.
Yeah.
That's actually, if you're listening to it and you're like, pay attention to that, Yeah. So this is how we start to learn how to tap into our own intuition, because none of us are made the same.
That's right. And I actually teach that in my practice. Those of us in this this holistic space, we use the term tune into your body a lot. People have no idea what that means. And so just teaching people how, what that looks like, what that actually feels like. People don't know how to feel at their heart center. We're so used to being up here, we have no idea how to sit in here, right? If you can see my heart here, right?
Yeah.
So, learning how to tune in and listen, because your body speaks a language that you're actually familiar with if you just know, what the alphabet is, for lack of a better metaphor. So teaching people that as well is really important so you can go out and fly. This is about you getting your wings. This is not about me making a ton of money or having accolades or patting myself on the back. This is about you being able to go out and now you transform the next billion, right?
Yeah, because we don't know what people are going to do. It's so exciting to find out once they're unlocked, like what's going to happen. It could be like, Neo in the Matrix and people are flying around, I'm jesting, but you never know what can happen. I leave the door open for that. So
I do too.
This is really exciting. So if you guys have really enjoyed listening to Jamie and you're like, I want to know more about her website is Evolve Integrative.
Yeah, nobody likes that word.
I know. .com.
It's a very annoying word. www.evolveintegrativecare.com.
Yes. Yeah. And she's also going to be one of our experts in the Skills Not Pills movement membership program, which is starting up in September. So we're really excited. You can actually click now and join if you want, if you're interested in finding out more. We've got membership levels, and the transformer level is really exciting because we'll be sharing DIY and skills and Q&A sessions. And actually, even if you sign up at the highest level, you'll get to actually just have a consultation with Jamie. So it's pretty exciting. I'm really excited about all these people coming together, these experts like yourself, medically trained, as well as people who have just been on audacious journeys where they've overcome like things that they were told, like, you're never going to get over that stuff.
Right.
That's the kind of people we got together, huh, Jamie? I'm pretty excited about it.
That's right. No, and that's who you want to learn from. I mean, you could learn from somebody who wrote the book, or you could learn from somebody who read the book and then did the work, and so who do you want to hang out with, right? You want to hang out with those folks that have been on that path. They are way showers for you, and all you simply have to do is put your hand out and they're there for you. So
yeah. Absolutely. Well, very exciting. I hope you guys really got inspired by this broadcast and hearing the potentials and finding out more. So, definitely visit Jamie's website. Definitely go to skillsnotpillsmovement.com. Check out the membership. Check out what we're doing. And I hope you guys come and play with us. This is really about play. We're really, this is turning the corner. This is no more suffering and all this dismal stuff. Right. This is about stepping into your power and co-creating reality all together, right? Because we're all one. We're all connected.
That's right. That's right. Happy to be here, Carrie. Thank you.
Thank you, everybody, for tuning in, and we'll see you next time on Skills Not Pills. Talk to you later.